So we did visual perception interventions. Just to preface this, we couldn't find too many evidence on this topic as far as OT interventions go. And there wasn't any consistency with it as well, which means it probably just isn't researched as much, or it's just difficult to like treat in a typical way. But we did find some evidence on different diagnoses. So the first one that I found was for visual processing dysfunctions, or VPD, and this is from birth. So it was early intervention, and they were babies that were born preterm. And it also said like extremely preterm. They have a high risk for developing VPD. This includes issues with orienting and maintaining visual attention, detecting and perceiving specific visual features and giving meaning to the perceived. And is detected at earlier developmental stages is how they find it. And with that, it can delay and disrupt neurocognitive, motor, and behavioral development, which is how it can typically be found, but it's still hard to like determine if there is an issue because it is visual perception and it is a baby, so they can't really tell you. But it's early. This says that early habilitation and early detection is important. So finding it early and being able to treat it early can help later on. So this was a single blind placebo controlled trial, which is a higher rigor on the pyramid. And the purpose of it was to explore the effectiveness of EI for VPD in children born preterm from 1 year of corrected age. The treatment group was a generalized protocol, which is the standard across like all of the participants, and then supplemental protocol, which is specific to that child's VPD. And this was performed for a year, and the other control group was actually not receiving any EI, and they were like deferred for a year. And they were able to measure this using eye tracking assessments. And it was found that there was improvement. The improvement could be due to like normal development. So it wasn't like super clear as to if it actually did affect it or not. So more studies definitely need to be done for this. But it was just an interesting study overall. And then the next one that I found was about exercise-based interventions, and it was for intellectual disabilities with deficits in cognitive, perceptual, motor, or CPM. And this is cognitive performance, processing speed, planning and control strategies, and working memory. And that's kind of what they're aiming to fix, as well as executive functioning and obviously visual processing. With this, they found that, or their hypothesis was that exercise-based interventions could enhance visual perceptual functions in children with developmental disabilities. And this was a randomized clinical trial, which is not, it's still pretty high because it is randomized. So it's still a good level of rigor. And they used actually table tennis training, which table tennis training involves complex motor skill learning, numerous repetition, and multisensory feedbacks. So it helps with neuroplasticity and functioning, and increases functional abilities to increase activity, participation, and independence. And for this trial, Group 1 received the TTT, Group 2 received standard OT, and Group 3 was the control and did not have any interventions. And overall, the skills improved significantly with a higher attendance rate, meaning that the students or the participants were more motivated to actually participate and go along with this activity. And it was also found that the standard OT was also effective, but that the TTT had a higher increase. So it was more preferred. And then the last one that I found that was also interesting was on schizophrenia. So they were measuring visual motion processing And with schizophrenia, typically you have poor performance in discriminating speed and direction of visual motion. And this basically measured perceptual learning. And this is enduring and consistent improvement in a perceptual task as a result of such training. And it's mediated by neuroplasticity. This was a controlled clinical trial. It was not randomized, meaning it's not as strong as the other two. And they used random dot pattern, or RDP. And these basically it was dots moving on, or it was white dots moving on a black background, and they had to determine which direction they were moving, like left or right, and which one was faster, so determining the speed. And it was found that their training on direction discrimination improved their performance on task. And what's interesting is the neuroplasticity-based training. So it was really helping to shape the brain and improve the visual perception in these individuals.
Right. So in another piece of evidence, they used 42 students from a second and third grade class, and they all had some sort of visual discrimination and timing deficits, and some of them had dyslexia and some of them didn't. It was a randomized controlled validation study, which is an experimental one that was pretty high up in rigor, and they used visual timing training and computer-based guided reading. So with the visual timing, they had a little video that they showed the kids that had low contrast gray strips in a frame that was in the shape of a fish, probably to keep them a little more interested. And the strips moved either right or left, and the students had to click on the arrows of their keyboard to report basically which direction they saw it go. There is a tone for an incorrect answer, and the program was actually smart enough to adjust to each student so that they wouldn't get overwhelmed or it wouldn't be too easy for them either. It was found that both in dyslexic and the non-dyslexic students, that their figure ground motion discrimination had improved, even with each increase in complexity. And then with the computer-based guided reading, each student chose an ebook that they would like to read, and the program recorded how quickly they read or listened to the book and measured their comprehension after each chapter. And so this showed overall improvement in attention, reading, and memory, which is related to visual perception. And this next one, they used 20 healthy adults, 10 male, 10 female, that had normal vision, and it was a controlled clinical trial, which is a little bit less rigorous of a experimental design study. And so they used LSF discrimination training, and that means low spatial frequency discrimination. So what they had to do is point out which of 4 gradings or lines had different spatial frequency. So you can see in that picture on the left there, the different lines. And so they basically had to choose which one was spaced a little bit differently than the others. And so each image that they saw changed randomly, and some even had noise masking, which means there's like almost like a filter over the image to make it harder. They also included post-training EEG tests, which I thought was interesting, and it measured how one participant would recognize facial expressions. There was no change in that because they were healthy adults, but there was an increase in visual spatial frequency discrimination as well as their reaction time. And then this last one, they used 40 male adolescents from 2 middle schools. And they excluded anyone with ADHD, and they couldn't really find any female participants. And it was a controlled clinical trial, just like the last one. And here they used high intensity functional training, which is similar to high intensity interval training, like some of you might know, but it included a functional multi-joint movement as well. And so they did this for 45 minutes by a trained instructor 3 times a week. And this improved short-term spatial learning, and significant improvement in visual spatial or visual pattern separation, which is like the neural process of taking visual stimuli and separating out in your brain and remembering it as something different.
So future studies, one thing that I found when researching, I found one article that talked about, I guess it was like post stroke training and driving for visual perceptual skills. And it was using a Dynavision apparatus, which I looked up, and it's this picture up here. And I just thought it was very interesting to see that, and how it works is like it, as you see, like there's dots that kind of pop up, and it kind of works on that visual and motor aspect. And it kind of goes into the one study I found, which is kind of similar, the one for the schizophrenia patients. And so finding like the dots, I thought it was very similar to that, but they actually didn't end up finding any difference in or improvement in like driving skills from the controlled and like and the treatment groups. So I didn't end up using it, but I think that it would be cool to see more studies using this and measuring the visual perceptual skills with it. I also thought there should be more EI studies. I know it's kind of hard to actually do studies on this. As we talked about, it's hard to do it on babies and to actually measure it, but I think it would be interesting if we were able to do that, and to measure the visual perceptual skills.
So some more future studies could be looking into the effectiveness of that LSF discrimination training. So instead of using healthy people, but using people that actually have visual perceptual disorders, and even including other populations like autism spectrum disorder, who might have social skills problems and recognizing facial features. And then another could be on the combination of visual perception and proprioception with spatial awareness, kind of like that last study that I talked about, just to see if they're more effective, if there's more improvement with combining the two or not.
And application for clinicians. So early detection and treatment of VPD could help to improve function and independence at a later age. This is just part of the one study I found for early intervention. And I just think that it's important to know that if you are able to evaluate someone who could have VPD, to follow up and help to improve their function. And then I also thought that adding exercise and games to practice can help to incorporate skills to enhance visual processing skills. I thought it was very holistic and practical. So playing the table tennis, that's something we could definitely do in OT, and it helps to combine everything. And also the proprioceptive ones could also be beneficial, as Alicia added. We both found one study that did incorporate like exercise, so I think that could be helpful for like intervention with this this type of disorder. And I also thought it'd be interesting to see more with people diagnosed with schizophrenia. I didn't really think about like visual processing with them before, and then I found actually a couple studies about it. Just one that was actually intervention that I was able to use, but I didn't really realize that they would have issues with this. So thinking holistically, and how we can improve their neuroplasticity. And then just in general, visual perception deficits can be present in many different diagnoses as shown. Like there's so many different ones, and you may never even know like when it can develop. So it's important to like keep that in mind when you're seeing clients.
Yeah, and one last thing is that the different interventions and trainings that we found, that they can be pretty much incorporated into any OT session as like little small activities, either in between things or as like a main activity as well. And these are our references.